Hello, and welcome to Helpful Think. Today we will be exploring 9 unusual ancient medical practices. Across history, different practices have been implemented into medicine. Sometimes physicians of the past got it right, and sometimes they got it very, very wrong. In this video, the procedures will get progressively worse, and the last one will shock you. Let's begin. Coming in at number 9 is animal dung ointment. The ancient Egyptians are known for their innovation in areas such as engineering and embalming. Their medical system was one of the most remarkable of this time period. Despite this, they had some practices that were questionable at best, one of these being the use of animal dung as ointment. Feces would be rubbed directly into the Egyptians' open wounds as a topical treatment. Animal excrement was known to be sort of a cure-all in the eyes of the Egyptians. It was even thought to ward off bad spirits. Although completely repulsive and obviously a horrible idea to humans today, researchers have proved that this medicinal practice was not completely ineffective. Although it could occasionally lead to further complications which could become fatal, such as tetanus and forms of infection, the microflora found in animal dung can contain antibiotic substances. Coming in at number 8 today is a practice known as bloodletting. This practice has been done across many different people groups as early as the Egyptians and Greeks. This practice is still done today in treatment of some conditions. The practice of bloodletting is the withdrawing of excess amounts of blood for therapeutic reasons. The ancient Egyptians, Greeks, and Romans were among the first to utilize this practice. The origins of this medical procedure were backed by the theory of the 4 humours. Hippocrates suggested that there were 4 liquids in the body: black bile, yellow bile, phlegm, and blood. He thought that an excess of any of these 4 elements could cause a person to physically become imbalanced. So, physicians of this time period would stick the patient's vein with a tool known as a flame. This would cause the patient to bleed and theoretically would allow the bad blood to leave the body, allowing the good blood levels to become harmonious. The most dangerous complication associated with bloodletting is surely an obvious one to people of the 21st century. Patients could bleed to death. Frequent bloodletting or removing too much blood at one time could cause the patient to die. Coming in at number 7 is the Tapeworm Diet. During the Victorian era, women were subjected to bizarre beauty standards. One of these included the requirement of a 16-inch waist. This could be achieved by corseting for some, but others had to take much more extreme measures. Thus, one of the first fad diets, so to speak, was born. Women would ingest a pill containing a tapeworm egg. Once ingested, the tapeworm would eventually hatch and take up residence within the woman's body. This would theoretically allow the woman to eat as she pleased and still lose weight, no matter her daily caloric intake. But once the ideal weight was achieved, how does one get rid of the parasite? The answer is they don't. Pills were sold to women claiming they could rid them of the parasite to no avail. Then, Dr. Mayers of Sheffield designed a device that was meant to retrieve the worm from the woman's stomach. Unfortunately, women would typically choke to death and die before this could happen. The worst part of this diet? It's still a fad in some places today. Similar to the worms, this tapeworm diet trend refuses to leave us. Coming in at number 6 is the use of massage to treat wandering womb. Wandering womb was a condition that was identified during ancient times. Recordings of this condition began in ancient Greece and continued to be diagnosed across Europe during the Middle Ages. This condition was thought to be due to a uterine displacement and was thought to cause physical and mental distress in females. Women were considered to be the weaker sex of the time. Menstruation and pregnancy were seen as a causation of mental distress and were considered to cause women lifelong ailments. Symptoms of wandering womb included anxiety, a sense of suffocation, tremors, convulsions, and even paralysis. Treatments for this condition included vaginal fumigations, potions, balms, and even genital massage, which was performed by a physician or midwife. I'll just let you draw your own conclusions about that treatment. Coming in at number 5 is the use of malaria to treat syphilis, which was surprisingly happening less than 100 years ago. Syphilis is a bacterial infection most commonly transmitted by sexual contact that starts as a painless sore and progresses in stages into a rash. The infection can lie dormant for years but can subsequently damage internal organs, ultimately the brain, leading to severe psychosis. During the year 1927, an Austrian psychiatrist named Julius Wagner Jauregg won the Nobel Prize for treating late-stage syphilis patients by infecting them with malaria. It was found that malaria would trigger extremely high fevers, which would subsequently kill the syphilis, causing bacteria that was found in the body. These late-stage syphilis patients were oftentimes infected with malaria without their consent. Jauregg would infect the patient with malaria, allow their temperatures to rise to levels as high as 105 degrees, and then would provide them antimalarial quinine. Many of his patients still died, most commonly from their syphilis, but sometimes from malaria. Although the statistics were not great, 25% recovered completely from both conditions. This meant that finally, late-stage syphilis of the brain was no longer a death sentence. This treatment seems inhumane in retrospect, but at the time was extremely celebrated, hence the Nobel Prize. However, not long after, penicillin was discovered, and the use of malaria to treat syphilis was no longer needed. The inhumanity of this research and treatment was also eventually acknowledged. Up next is number 4, the metallic catheter. Just take a moment to consider that. During medieval times, metallic catheters were used to relieve the symptoms of urinary issues. During this time period, a lack of antibiotics and a surplus of venereal diseases, like the aforementioned syphilis, concocted the horrible and painful result of a blocked bladder. To relieve this blockage, a metal tube, what we know today as a catheter, was inserted into the urethra. There was unfortunately no way to numb this treatment, and patients were unlucky enough to feel every bit of pain. Ouch! Coming in hot at number 3 is treating hemorrhoids with a blisteringly hot iron. If you have ever had a hemorrhoid, you know the pain, and it's an unpleasant condition. Saint Fiacre, who is unfortunate enough to be known as the patron of hemorrhoids, was a 7th century Irish monk that allegedly cured his hemorrhoids by sitting on a rock. The rock that he allegedly sat upon to relieve his hemorrhoids was prescribed to patients by doctors to spend time sitting upon it. However, this treatment was of course useless, and the Irishmen of the Middle Ages found another alternative to cure their hemorrhoids. Hot irons were placed up the rectum to cure hemorrhoids. Although extremely painful, physicians were able to back this practice by the findings of Hippocrates, who found that hemorrhoids could be cauterized by the hot irons, essentially burning them to the point that they were no longer hemorrhoids. I think I'll just stick to preparation H. Coming in at number 2 is the practice of trepanation. Trepanation, also known as burr holing, is a surgical procedure in which a circular piece of bone is drilled from the skull. During the Middle Ages and the Renaissance, trepanation was practiced as a cure for various ailments, including seizures and skull fractures. There is evidence to support that this would even occur during the prehistoric period. For some reason, people have always thought that it was a good idea to make large holes in our heads to solve mental or physical issues occurring in the brain. Unfortunately for the patients, the hole to the head commonly exposed the dura mater of the brain to airborne germs, which proved to be fatal for patients. And our winner of today's video, as the most gruesome and diabolical medical practice on this side of history, medical cannibalism. Also known as corpse medicine, this practice reached its peak during, you guessed it, the Middle Ages. This was seen across Europe and China. In Europe, most of the materials used for consumption were the Egyptian mummies. Medicines, tinctures, and powders were created from the mummies. The people of this time had a saying that went like cures like, meaning if you had a heart condition and you consumed the heart of another, you would be cured. Fresh blood was also seen as a sort of elixir potion, and in Germany, fresh blood was especially regarded. The poor would often bring a cup to executions and bribe executioners to allow them to fill their cup with the envied liquid. In China, the consumption of human flesh dates back to the Tang dynasty. Young people were expected to do everything in their power to improve the lives of their parents, and if a parent were to fall ill, the child was expected to cut a piece of their flesh off and serve it to the ill parent. Due to the supposed healing properties in human flesh, Emperor Weizong of Tang would order officials to bring him the hearts and livers of young people, hoping their consumption would bring him a long and healthy life. Later, during the Cultural Revolution, which occurred from 1966 to 1976, hundreds of incidences of cannibalism continued to occur in China. These cannibalistic acts were not due to extreme hunger or famine, but were known as flesh banquets. These flesh banquets were due to cultural and political tensions of the time. That concludes our video for today. If you made it this far, thank you so much for watching. Let us know in the comments if you think we did a good job, and let us know if we missed anything. Please subscribe to Helpful Think and like this video. Cheers, mate.